It's been over a year that the world has been grappling with COVID-19, and the pandemic is currently in its second wave in Nigeria. From partial to total lockdowns and the adoption of non-clinical measures, as well as adopting basic hygiene practices, many countries have been adopting a wide range of measures in the fight against the pandemic. As COVID-19 cases continue to rise in Nigeria, President Muhammadu Buhari recently signed the COVID-19 Health Protection Regulations 2021 as part of efforts to boost the COVID-19 response in the country. The regulations enshrine social distancing, the use of face masks, and guidelines on public gatherings into law. The law, which comes in 6 parts, include restrictions on gatherings, operations of public places, mandatory compliance with treatment protocols, enforcement, among others. While some Nigerians have lauded the regulation, how effective will it be towards curbing the spread of COVID-19 in the country? With the introduction of punitive measures, how will the regulation be enforced towards checking the spread of COVID-19? Now, these are just some of the salient issues up for discussion on the program. Do sit back, relax. This edition of Nigeria Today promises to be an informative one. I'm Chimaobi Walter Naji. Welcome. I have with me in the studios to discuss the COVID-19 Health Protection Regulations 2021, Dr. Mukhtar Mohammed, National Incident Manager, Presidential Task Force on COVID-19. It's a pleasure to have you on the program, sir.
Good evening. Thank you for having me.
All right. First of all, could you take us through what necessitated, the introduction of these regulations?
So actually, we have come a long way since this pandemic started in the country. And we knew from the outset that the only weapon we have against this infection is through regulation of or introduction of public health containment measures. That is to ensure that we do whatever is necessary to prevent the infection from being transmitted from one person to another, and transmission also in the community. So we have, you remember around end of February, March, when we had our first case, the entire government became sensitized, and Mr. President was very quick to respond to constitute a whole of government approach. We have at least no less than 12 ministers, 3 director generals, and also some additional ministries and parastatals that were co-opted into what is the Presidential Task Force on COVID-19 to coordinate the response, because Mr. President realized that in order to control COVID, it is not just a health sector alone. We have to have other sectors involved in the fight. So from the very beginning, we started with these public health containment measures, which is use of face mask, social distancing, and also cleaning up our hands regularly. And if you recall also, during the first wave of the epidemic, Nigeria had to go into lockdown towards the end of March. And that lasted for about 4 weeks. We had an extension, selected cities, then later we added more cities in the lockdown. And largely that has been an effective way to control the rapid transmission of the infection. However, when we eased the lockdown, and with all the things that have happened, I think people went back and relaxed, and we were not so careful as a people. We became more relaxed, and then the infection started coming up again, thus having this second wave.
Okay, so can you take us through possibly what are the nitty-gritty of what contains in the regulations?
So the regulation largely is to ensure that there is a legal framework that can be used during enforcement. And it has different sections. You have the section on public gathering. So the public gathering aspect restricts the number of people that can gather in any enclosed space, which is said not more than 50 people, except in religious places. It also covers offices, government buildings, public places, schools, etc., where these interventions need to be, these protection measures have to be carried out. The regulation also empowers not only the security agencies, but it also expects the owners of such places to institute the measures and be the custodians, of compliance to this regulation. For example, if I own a supermarket, it is my responsibility to ensure that anybody that does not wear a face mask does not have access into the premises. And it is also my responsibility to ensure that I detect the temperature of anyone entering into the place. And people that are found to have temperatures above 38 degrees centigrade should be denied access. And it is also my responsibility that even when people have entered into the premises with a face mask, to ensure that if they remove it, we quickly have a system to caution them and ask them to put it back. And if they refuse, then they are liable to prosecution.
Okay, so with the rising, COVID-19 cases across the country, how effective will these regulations be, bearing in mind that previous measures maybe didn't perform as expected?
So certainly, based on evidence, from the scientific point of view, using these regulations is going to drastically reduce the number of new infections that we are having in Nigeria. We know that if somebody uses a face mask, he reduces the chances of transmitting infection to someone else by maybe about 40 to 50%. But if the two people use face mask, both of them, then they have an increased chance, about 70%. So if we are to mask, if everybody in Nigeria now will mask up and we comply by these regulations, certainly the rate of new infections is going to drop, the rate of transmission is going to drop, and we'll have less cases going to our hospitals, and we'll also have less mortality. So this is a scientific fact. There is no doubt about that. However, we know that we cannot achieve 100%. That is why we want to get as many people as possible to mask up, especially in areas that we have marked as very high burden states or cities in the country.
Now, let's look at it this way. You did say earlier that, the regulation states that no gathering of more than 50 persons shall hold in an enclosed space, except, of course, for religious purposes, in which case the gathering shall not exceed 50% of the capacity of the space. Now, how implementable is this?
It's very simple. Our churches have seats. So on the seats, since it says 50%, all you need to do is to have alternate seats. So that you jump every one seat. You either close the seat, you cross it, you turn it back, or you do whatever, so that only 50% of the seats will be occupied by the congregation. In our mosque, we have rows, that we form to perform salat. So in the rows, we also ensure that we maintain a distance of that 2 meters between one person and the next on the same line. And when we go to the second row, we also have the same thing. So what we will do for the mosque is to ensure that we have markings placed on the floor where people can stand and where people will not stand. So in that way, we will also be able to reduce that space to about 50% of the people that will be in the mosque at a time. Now, the implementation of this, that is what has to be done. We cannot implement this without taking our religious leaders along. We have to sensitize them. We have to take them along in all these decisions, and we have them to buy into the idea. It is not by force, but we have to get them to buy in, to understand that all these measures are to protect the people, the congregation, and the community at large. Then, of course, we will now have monitoring, supervision, and the enforcement can now start.
All right, so before we get into sanctions for violators, the regulation also states that persons confirmed positive for COVID-19 by an NCDC accredited laboratory may not refuse isolation and or admission to a designated health establishment for management of the disease. Now, how practicable is this, considering the kind of environment that we find ourselves?
So, under normal circumstances, when somebody tests positive and he is willing to go to an isolation facility, that is not a problem. The person can be accommodated in an isolation facility and monitored to ensure that he doesn't transmit the infection to the rest of the community. However, if the person wants to stay in his house, and based on the assessment of the health authorities, they now they deem it fit that he has adequate space to observe self-isolation, the person will be allowed to self-isolate in his house and be contacted by the health officials on from time to time. However, where somebody is staying in a one-bedroom apartment, for example, and with a family of say 4 or 6, it is practically impossible for that person to self-isolate. So in that case, the health authorities will advise him that staying in this environment will jeopardize the members of his family, and therefore he may need to be isolated. So this regulation now empowers the law enforcement agencies and the health officers to also insist on taking this person out of that premises to an isolation center.
Well, so let's look a bit at the provisions, sanctions that has been provided for in this regulation. Now, notably, the regulation states that any person that contravenes provisions of the regulation risk a fine or a term of 6 months imprisonment or both. Now, who are saddled with the responsibility of enforcement?
So I think the Constitution is very clear. The law enforcement agencies are responsible for enforcing the law, and therefore,
when you say law enforcement agencies, you're talking about precisely the police or all of them?
The police, the Civil Defense Corps, and a host of them. I think in the law we specifically mentioned immigration, because some of these issues may happen at the borders, at the points of entry. We also included road safety, because there will be road traffic violations where you take people in buses or taxis. So all the relevant agencies are included and they can enforce this law. However, the states are working now to develop what they call their own task forces. So these task forces will include the law enforcement agencies, the health officials, as well as perhaps tribunal or a mobile court that has the authority to prosecute people instantly.
All right, many thanks, Dr. Mukhtar. We'll have to take a breather now and go on a short break. We'll be back in just a moment.
You fit touch black man. If you like, gather the whole Niger, come together, make the cough. Nothing.
Which one you want?
Give me V&D.
I beg, get small pieces.
How much you want to give them?
Give me 200. Take your change now. You don't want your change.
My people, this coronavirus, na serious matter. No, now wash your hands regularly. Come use alcohol-based hand sanitizer. If you no see water, wash your hand. Make una sit down for house. You see this virus, so it no get leg. Now we dey waka kurukere. No wakara make the virus for die. No forget say the betterment of our people. Now for your handy day.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Welcome back. If you've just tuned in, the program is Nigeria Today, and we're discussing the COVID-19 Health Protection Regulations 2021, recently signed into law by President Muhammadu Buhari. And still with me in the studios is Dr. Mukhtar Muhammad. He's the National Incident Manager, Presidential Task Force on COVID-19. Now, can we call this regulation an executive order?
Yes, it is.
Okay, can you expatiate a little bit?
Well, it is an executive order. I don't have the legal terminology, but when a president signs a regulation into law, he is empowered to do that, and it becomes effective from the time the president signs it.
So looking at that, we don't need ratification or any of sort from the National Assembly.
Because the National Assembly has already passed the National Quarantine Act. The National Quarantine Act specifically provided, the framework upon which this regulation was formulated. So this, I believe, the president is already empowered to provide this regulation that will now be carried out by law enforcement agencies. It's completely in alliance with the provisions of the Constitution and also in alliance with the National Quarantine Law. Mind you, in developing this, we consulted widely. We had input from all the states of the Federation, and we also had a significant input from the Office of the Attorney General of the Federation.
All right, so there are fears that international travels into the country is contributing to the rise in COVID-19 cases. If it's true, how is the regulation addressing this?
So we have looked at the data, and you know that very early on when we opened our airports, we had some regulation that actually helped us, to look at the issue of international travel. Before you arrive in Nigeria, you have to be COVID negative using a PCR test at least 96 hours before you arrive. So that gives us, some degree of certainty that the person for the last 3 days or 4 days at least was COVID negative. Then you arrive in Nigeria. If you arrive in Nigeria, you have to go into quarantine. You have to isolate for at least 7 days. And then on that 7th day, you will also have a repeat PCR test, which is the gold standard. So at least by this, we are filtering all the people who are entering the country, and we put specific emphasis on countries of interest, that is countries that have very high prevalence. And when the new mutant started coming out, we also put more emphasis on UK and South Africa. So the process ensures that most of the people who arrive in Nigeria are COVID negative. We have looked at the data of all the travelers that are coming. The rate of infection is by far small. It's a drop in the ocean compared to the transmission that is going on in the country right now. So it is not the international travel that is responsible for the current second wave we are having.
Okay, so what role, should state governors play in their respective states towards checking the spread of COVID-19, especially with the current regulation in place?
Certainly, the state governors, in fact, have most of the responsibilities, because it is clearly within their role. It is clearly within their power to ensure that they take the health of their people very seriously, and they should do everything possible to minimize the risk of transmission in their states. This regulation empowers the state governors also to be able to supervise, monitor, supervise, and also impose sanctions where necessary. So the state governors are all expected to set up their task force, the teams that will be monitoring, supervising, and ensuring compliance to this protocol.
All right, so still talking about that, I'm aware that most states in the country, if not all, have already set up a task force, on COVID-19. The FCT has one. I'm sure many other states does. Now, is there a regular interface between the PTF and the state task force to ensure that the response is a national one?
So absolutely, we have multiple phases of interface at various levels. If you take the Presidential Task Force, for example, we meet almost every 2 weeks with the governors forum. So this is an ongoing meeting where the PTF and the governors discuss issues of implementation, of funding, of challenges, and of strategy. That is at the policy level. We also have the technical arm where the National COVID Response Center, which is the incident management structure, interfaces with commissioners of health, the state task forces, and also the relevant stakeholders at that level. Then the NCDC also holds weekly meeting with the state actors, which are mostly the state epidemiologists and directors of public health. So there are multiple levels of interaction. The Minister of Health also hosts a meeting with commissioners of health, and also hosts a meeting with the CMDs of teaching hospitals and federal medical centers. And this happens almost weekly. So there are multiple levels. We are interacting with the states, and we are making sure that the response actually has a national outlook.
Well, so having the vaccines readily available in the country within the next month, is it still feasible?
Well, we are hoping it is still possible, and we have received assurances that we will have these vaccines. The first 100,000 doses, we've been told, will arrive by February. But looking at what is going on globally, we have to be very conscious and be very realistic. Just today, we understand that the EU has further restricted the movement of vaccines out of the European Union. So these are all counterproductive measures as far as Nigeria is concerned, that will make it perhaps more difficult or more challenging to be able to really stick to the deadline or a particular date that we have been given. We are aware of these dynamic circumstances. However, the country is doing its best and expanding our alternatives also to make sure that if one source is closed, other sources remain opened.
All right, so unfortunately our time is fast spent, but looking at the regulations and, like I was saying earlier, the issue of enforcement and getting people to comply, don't you envisage a situation where the correctional centers may be filled up with violators who may in one way or the other fall short of this regulation?
Well, I'm not sure. I know that Nigerians may be difficult in the beginning, but I know that Nigerians can also be very law-abiding. I have the faith that people understand the objective of this exercise. It is not meant to be punitive. It is not meant to be restrictive. And therefore, when people have that understanding, I believe most people will try to comply. And when it comes to prosecution as well, I'm sure the task forces will also be very professional about it, and mostly will be taking fines, because actually right now I think the country even needs more funds to be able to run this response. It is a very expensive response. So the option of fine is there. It's only when you are not able to pay the fine that the option of jail becomes possible. But this is left to the tribunal to make that decision.
I see. So we'll just in 30 seconds have your final thought.
Well, I want to call on Nigerians and the general public to actually look at these restrictions, the law or the regulation that has now been signed by Mr. President, as something that, as a tool that will enable us to control the epidemic, to be able to bring it to the barest minimum. If everyone uses their face mask, if everyone complies to these regulations, I tell you, in no time, Nigeria would be able to crash this COVID-19 transmission in the country.
All right, thank you very much. This is where we draw the curtains on today's edition of the program. I must thank Dr. Mukhtar Mohammed, the National Incident Manager, Presidential Task Force on COVID-19, for shedding more light on the Health Protection Regulation 2021. And to you, our viewers, many thanks for tuning in. Nigeria Today returns Monday and is live every weekday on NTA News 24 at 7:30 in the evening. You can also watch this and other editions of the program on www.youtube.com/NTA News 24 Hub. I'm Chiwobi Walter Naji. Many thanks for watching.